Hello, I am State Senator Laura Fine. Over the course of the pandemic, I've had many people reach out to me on a number of issues. Some constituents have not only lost their job, but they've lost their insurance because it is tied to their employment. Although some people qualify for COBRA, COBRA can be extremely expensive. And during this uncertain time, families need coverage not only to protect their health, but also their well-being. If you find yourself in a situation, there are options available. With me today is Brian Gorman. He is the Executive Director of Outreach and Education with the Illinois Department of Insurance Get Covered Illinois program. Thank you so much for joining us, Brian. We have lots of questions for you. But the first one is, can you give us a walkthrough? What is available for families or individuals who might find themselves in a position that, you know, here they are in August and no longer have insurance?
Sure, and as you mentioned, you know, there are a tremendous amount of people across the state who are finding themselves in the midst of a pandemic, no longer without their employer-based healthcare coverage, not knowing where to turn to, where to go. So all of us at Get Covered Illinois and the Illinois Department of Insurance want to be a resource for the state residents who may have questions about what their options are. What do I qualify for? How do I get help? How do I walk through the process? So I want to thank you for the opportunity to spend some time with you today and perhaps answer some questions about what Get Covered Illinois is, what the Affordable Care Act is designed to do, and how to seek relief today if you are separated from your employer-based coverage, but also as we look forward to November, which is the normal time for open enrollment period.
Great, thank you. Would enrollment normally be open now?
No, actually, you are correct that this is kind of an unusual time. Usually we have these conversations in late October and into November. The open enrollment period traditionally takes place on November 1 and continues through, can qualify for what we call special enrollment periods or SEPs if they have certain qualifying life events like separation from your job, and we'll kind of go through that in a little bit. But special enrollment periods allow people to enroll in a new plan or to make changes to their current plan if certain qualifying life events are occurred. And people generally have 60 days from the period of which they are separated from their employer-based coverage to enroll in a new plan. But we want to encourage everybody, even if you're within that 60-day window, to take some time, shop around, go to getcoveredillinois.gov and find out what your options are.
Okay, you mentioned there are some qualifying life experiences that have to take place in order for you to be able to apply now on the exchange. What are some of those situations?
Certainly. Well, the one that's most pressing and certainly is top of mind for everybody across the state is if you've lost your employer-based coverage. If you get your job through your employer and you've lost your job and that health care goes with it, then that would trigger a qualifying life event or special enrollment. But there are also events like birth of a child, getting married, moving to a new area or a new county. So I think the most important thing is for people who need health coverage, take the first step, go to getcoveredillinois.gov, start the process, try to find some help, and see what you qualify for. So there are people that may turn out to be falling within certain income categories that may enable them to enroll in a Medicaid plan given their financial circumstances. But we can't do anything and help people unless you find out what you're eligible for.
And so how do you start this process? If you could just walk us through it.
Sure. So the best thing that you can do is go to getcoveredillinois.gov. There's a button there where you can kind of start the process. And then either depending on how large your household is, whether someone is expecting, how much money that your family is earning each month, it's determined whether or not that you're eligible for a marketplace plan or through Medicaid, which is a program run through the state of Illinois' Healthcare and Family Services. But that's the first step to enrolling, and then at that point, you can shop for plans. But also, when you go to Get Covered Illinois, you can find help that you can reach out to. Obviously, pre-pandemic, that could have been in-person help, but you can still, there's a number to call to find out someone who can kind of walk you through their options. We know that health insurance shopping can be challenging, and we want to make sure that people know that there is support for them as they go throughout this process.
Brian, I know you have a presentation. If you could walk us through the slides, that would be great.
That would be perfect. So what I want to do is just share real quick, if I could just get the ability to share my screen. It's disabled participant screening.
Well, you're working on getting your screen up. Who's eligible to apply?
Sure. So if you are if you live in the United States, if you are a
Brian, I think you're muted.
I hit the wrong button.
There you go.
Okay. All right. So just kind of going back to your question, who's eligible to apply? Well, people, if you live in the United States, if you are a U.S. citizen or national, if you're not incarcerated, and if you are not already have health insurance through your employer, you will be eligible to enroll. But again, we're encouraging everybody who doesn't have coverage, who's thinking about coverage, go to getcoveredillinois.gov. Find out what you may be eligible for. There's all kinds of information. There's fact sheets in multiple languages, in Spanish, in Polish, Chinese, Tagalog, and English. So you can get as much information as you need, but you need to take that first step and finding out what you may be eligible for.
Great. And if you could just walk us through the presentation now, that would be fabulous.
Okay. So I just want to briefly kind of go through what Get Covered Illinois is, and we are a business unit within the Illinois Department of Insurance. Want to talk a little about the Affordable Care Act. I know that the ACA, or the Affordable Care Act, has been the law of the land for more than 10 years now, but certainly there are some questions about the benefits contained within that. And I want to touch on real quickly for application for benefits eligibility or Medicaid. ABE is the process by which you apply. And then to talk about free enrollment assistance. Again, shopping for and thinking about health insurance isn't often the easiest, and we want to make people understand that there is support for you through the state free of charge to you. So obviously the ACA, the most important thing it did was reform the health insurance industry to expand access to coverage. The ACA provides affordable coverage through two main vehicles. One is the Marketplace, which is healthcare.gov. The state of Illinois works very closely with our federal partners so people can shop through healthcare.gov. But also, Illinois was one of the earliest states to expand Medicaid. So those childless adults who may meet the income threshold can also receive quality, affordable health care as well. So those are the two main vehicles. But the real important things that the ACA did was establishing the 10 essential health benefit categories. Each plan, regardless of your income threshold or the metal level which you shop for, or you're on Medicaid, contains 10 essential health benefits. So you know that the plans that you're enrolling for you and your family are quality, and you know what's in there. Pre-existing conditions. I know that we keep talking about this, but it's very important. You are no longer able to be denied coverage because of a pre-existing condition. So those practices of the past are no longer an issue. So regardless of what you're going through, when you enroll, if you're eligible to enroll, you can qualify. It eliminates the annual and lifetime dollar limits. Again, the medical bills often are the largest driver of personal bankruptcy, and these lifetime dollar limits and caps and maximum out-of-pocket costs are certainly eliminated through the ACA. So the 10 essential health benefits, I just want to go through them real quick. The ambulatory care, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services center. You and I had talked briefly earlier about the importance of mental health, and those benefits are contained within prescription drugs, rehabilitative services lab, free preventive care. Again, getting your annual checkup with an ACA compliant plan is included, and obviously pediatric service, including vision and oral care. So regardless of where you get your insurance, what the carrier with the insurance company is through Medicaid, all ACA compliant plans will have these 10 essential health benefits. So I just touched on it real quick, the people who might be eligible for Marketplace plan. If you live in the United States, if you are a US citizen or national, if you're not incarcerated, and if you don't currently already have insurance through your employer, if you qualify for Medicare or Medicaid or CHIP or other source which provides what we call qualifying health insurance, but anybody else would be eligible to enroll in the Marketplace. So when? Now normally we would be having these conversations in the autumn, but as we get to November 1st to December 15th, that's normally when the open enrollment period is, and this is going to be our 8th open enrollment here in Illinois. But there are also what we call special enrollment periods, or SEPs. And then you are eligible for an SEP if you experience certain qualifying life events, like job loss. We're seeing that across the country. The impact of them is not necessarily just germane to losing your job, but also people are losing their health coverage at record rates. If you move from one area to the other, that would trigger a qualifying life event. Getting married, having a baby, or adopting a child, and you have 60 days to enroll once you experience those qualifying life events. So the best advice I can give to people who are thinking about, do I qualify? Where do I fit in? Take the first step. Go to getcoveredillinois.gov, start the enrollment process, and through the enrollment mechanisms, there will be a determination as to whether you do in fact qualify for that SCP. But we can't do anything for you unless you take that first step by going to Get Covered. So as I talked a little bit about some of those really important qualifying life events. Moving, people don't realize that if they move to a different county or a rating area, getting married, congratulations, having a baby, they will provide you the opportunity to enroll. But even if you are currently in a Marketplace plan right now, we want people to take some time and start thinking about November. Open enrollment is coming up as well. So these are just a couple screen grabs for folks who might want to get a little advance on what they might look for when you go to Get Covered Illinois. There's clear buttons to find the coverage that's right for you right there front and center. But finding help is easy. You just enter your zip code, one click away, and then there'll be a number of certified qualified assisters who work with the Department of Insurance to provide a walkthrough, help you understand what your options are, and get you into a plan that meets the best needs for you and your family. As I mentioned earlier, healthcare.gov is the enrollment and eligibility vehicle that the state of Illinois uses. It's the federal website where you can compare plans, benefits, enroll. You can shop for all the available plans that are in your county or area code. And every plan that is posted on healthcare.gov, as I mentioned before, has those essential health benefits. But I think the really important thing that people may need to know and need to understand is that when you go through healthcare.gov, you enter your household financial circumstances. It'll determine whether you do in fact qualify for financial help. 80% of Illinois residents who enroll in a Marketplace plan receive some sort of advanced tax credits to help offset the cost of their premiums each month. 80%, and that's on a sliding scale. So depending on where you are on the income threshold, you may be paying as little as $75 or $100 a month for your premium. So that's one of the benefits of going through healthcare.gov and Get Covered Illinois. I mentioned briefly premium tax credits and who qualifies them. They are refundable credits that are paid to insurance companies in advance that help cover the cost of your monthly premiums. Sometimes these APTCs or tax credits are referred to as discounts or subsidies, but there is help to pay for them. As in 80% of Illinois residents are receiving some sort of financial help to make their premium payments each month. And then, obviously it depends on where you are in the sliding scale, but you can shop for and figure out what you're eligible for going through healthcare.gov. So a couple of key numbers. The marketplace, if you do go through healthcare.gov, you may determine that you're eligible for Medicaid, and your application will be filled out and sent to Healthcare and Family Services, and they'll fulfill that. Or you can call the marketplace directly at 800-318-2596, and get your information that way. So touch real quickly. I know that many people who will not be declaring any income in the coming months will be eligible for Medicaid. Again, this is just a different program. All plans sold through or issued through Medicaid and Healthcare and Family Services contain those 10 essential health benefits. So the quality of the insurance coverage is equal to what you may find on a marketplace plan. But when you go through the application for benefits eligibility, you can find out what you're also may be eligible for. SNAP, which essentially nutritional assistance program, Medicare savings program. So if you're dual eligible for those services, by going through the ABE system, you're not just eligible for Medicaid, but you'll be able to find out what else may benefit for you and your families. And I can't say this enough, is that one of the things that we're most proud about at Get Covered Illinois is connecting individuals who have questions, concerns, just need that kind of assistance as they're trying to determine what they're eligible for. There's free enrollment through the Illinois Department of Insurance. They're trained annually. Every year there's a new training program. And then by going to Get Covered Illinois, you can type in your zip code, and then there'll be a tool which provides help in your area that you can reach out to and call, and they can kind of walk you through the process. You may hear them referred to as navigators. Some call them assisters or guides or certified application counselors. But the important thing is that there is support for you free of charge through getcoveredillinois.gov. So lots there. There are a ton of websites. All of these links and numbers can be found by going to getcoveredillinois.gov. That is probably the safest place to be. From time to time, you may go to ABE to enroll in Medicaid or to healthcare.gov, but we provided some resources and information that's easily accessible, FAQs in multiple languages. So if people have any questions or concerns, that's the best place to go. So real quick, I know I kind of went through those very quickly, but I want really Illinois residents to know that if you don't have coverage, if you're separated from your employer recently, if you already have a plan and you're thinking about November, the best thing that you can do is to go to getcoveredillinois.gov, start that process, and to find out what it is that you may be eligible for.
Thank you so much, Brian. This was so helpful. And there are a couple points that I just want to reiterate, because many people right now feel overwhelmed, helpless. They don't know where to turn. But if you do go to Get Covered Illinois, one, you'll find somebody who can help walk you through the process, so you're not alone.
Correct.
You don't have to. You're not in this battle alone. Somebody's going to help walk you through it and hold your hand and make sure you get your proper coverage. And another point that you made that is so important to remember too is there is help available so you can afford these plans. Because again, many people feel helpless right now because they may have had two-income families where one of the spouses, not only did they have income coming in, but their job held their insurance, and now they may no longer have that. So their income has been cut tremendously, but that doesn't mean that there's nothing out there for them.
That's correct. So we don't want the financial fear to be a barrier for people to understand what they may qualify for. As I said, 80% of the people that shop on Marketplace receive some sort of help to walk them through, or sorry, to help pay their premiums each month. A significant number of those people actually receive discounts or reductions in their cost sharing through a different program as well. So there is help, and then certain people who have no income at all or lower than a certain threshold can qualify for Medicaid as well. So it's really important.
Absolutely. And something else you had mentioned too, that if you do qualify for Medicaid, the Get Covered Illinois will walk you through what other benefits you can apply for as well.
That's correct. So it's SNAP nutritional programs, TANF. So, once you get into the system, we can kind of figure out what else you may qualify for, which will get folks through these difficult times.
So Brian, during this pandemic, the need for mental health and behavioral health coverage has been greater than it's ever been before. How can people be sure that even though it is outlined in the essential benefits, that they are going to be able to get the coverage they need for these services?
That's a great question. And as you mentioned before, people are, it's something that everybody's concerned with. But there's a couple of things that people need to know. Mental health and substance use disorder benefits are, as you mentioned, essential health benefits within every plan sold through Medicaid or through the Marketplace. But also the Department of Insurance and Get Covered Illinois is committed to making sure that mental health and substance use benefits are on par or parity to medical surgical. And I think there's a lot of questions that people are having, and I want to let people know that parity generally means that your insurance company must provide an equal level of coverage for mental health and substance use disorder conditions as it does medical and surgical conditions. So that means generally that the financial requirements like co-payments, deductibles, treatment limitations, out-of-network benefits, and medical necessity determinations all must be equal for mental health as well as medical surgical. So there can't be a separate deductible for your behavioral conditions as it is for breaking an arm. And the Department of Insurance is here to protect your rights and provide relief for Illinois constituents who feel like their rights may be violated. So it's really important. If you have any questions or concerns about that, first thing to do is you need to call your insurance company. But the next step would be to contact the Department of Insurance and saying that your rights may be violated.
And we had some other questions that are the frequently asked questions that I just want to touch on before we wrap up here. You mentioned that the exchange itself opens in November, and here we are in August. What do you say to the person who's like, well, maybe I can just wait? Don't worry about the special enrollment period.
Yeah, we tell people that, look, that having health coverage is vitally important. We're all just, one moment away from an accident or a medical condition, which would potentially will cause financial harm to us and our families if we're not covered. Nobody plans to get sick. I think obviously in the midst of this pandemic, all of us know that we need to be cautious and careful and safe, but there are some things certainly out of our control. So, a thing like a broken leg or a time in the hospital can mean thousands of dollars. So it doesn't cost anything to shop and see what you benefit for. And as you mentioned, 80% of the people across the state receive help. So take some time, shop, and get covered.
And when would, if you purchase a policy now, when would the first payment be due?
Well, the first payment would be due. You'll be receiving some contact from the insurance company, which you do select. But the payment will be due shortly thereafter the person first enrolls.
Okay, and just one final question. If I do go to the exchange, what kind of different levels of coverage will I see? What kind of different plans are there?
So they are grouped together in what we call mental levels, gold. All those determinations just kind of figure out what responsibility that the insurance company pays for each month versus the consumer. One may have a higher deductible or out-of-pocket cost, but a lower premium. But it's important that people understand that regardless of meta level that they select, they're all contain the same quality essential health benefits. I think what is very helpful to people is getting that assistance through a navigator to kind of figure out what their insurance needs are for the upcoming year. But again, the most important thing people can do is go to getcoveredillinois.gov if they need insurance coverage, they have questions, information is available in a number of different languages, and then from there, we can figure out what you may be eligible for.
Great, thank you so much, Brian. Getcoveredillinois.gov. It's an easy website to remember. So we'll go there, we'll make sure we get the coverage that we need, and make sure that everybody can get through this pandemic in a healthy fashion and be ready for the next enrollment period come November. Brian Gorman with the Illinois Department of Insurance, Executive Director of Outreach and Education for Get Covered Illinois. Thank you so much for sharing this information for it. You're going to put a lot of people's minds to rest tonight, knowing that they can get the coverage that they need for their families in an affordable fashion.
Thank you so much for having me.
Great. And thank you all for joining us today. Have a good one.